I'm Emily Bonnell, and I have cystic fibrosis. Think what your life would be like if you couldn't digest your food. If every time you ate you had to take medications just to get the basic nutrients you need. That's the life I live.
Emily deals with this issue daily. She is such a warrior, but there is so much more that we can do to make sure that people get the help they need with EPI.
EPI, or Exocrine Pancreatic Insufficiency, is a condition that affects millions of Americans. It occurs when the pancreas does not make enough of the enzymes needed to digest food. EPI is common in people with cystic fibrosis, pancreatic diseases, diabetes, and other conditions. In fact, EPI affects 20% of those with chronic pancreatitis, some 16 million people, and 90% of patients with cystic fibrosis. The consequences of EPI are serious. Many people with EPI experience severe anemia, vitamin deficiency, and significant weight loss. EPI can also cause bleeding disorders, bone pain, and muscle loss. The good news is that there are effective tests to diagnose EPI, and treatments are available.
Correct diagnosis is extremely important. This allows patients to access important medications and make lifestyle changes.
If people aren't on the right dose, if they're not on the right medication, if they're not being treated in an aggressive way, then we're missing that time in which they could be having the best health that they can.
For many patients with EPI, treatment known as PERT, or pancreatic enzyme replacement therapy, is necessary so patients will have the enzymes to support digestion. There are 6 approved PERT medications, all with different dosing and formulations. However, insurance coverage of the PERT medicine the health professional prescribed can be a problem. In some situations, health plans may limit coverage to 1 or 2 medications. Another obstacle, called step therapy, is when a health plan forces the patient to try and fail on different PERT medications before approving the one the health professional prescribed. A third health insurance practice is non-medical switching, in which a health plan may drop a medication from coverage or increase the patient's copay so the medication becomes unaffordable after the plan year has begun. As a result, a stable patient is forced to switch to a different medication that might not be as effective for EPI and other serious conditions. Health insurance policies that limit access to treatment for EPI can be life-threatening. Insured patients have a right to an appeal if they cannot access their medication. For more information on your coverage rights and the health insurance appeals process, visit coveragerights.org. If you or a loved one have exocrine pancreatic insufficiency, you can join EPIC, the Exocrine Pancreatic Insufficiency Coalition. You can learn more about EPIC and sign up for our newsletter by visiting aimedalliance.org/EPIC.